Karen Green. She is running for House Representative for the 7th Congressional District, which includes Seminole County and parts of Volusia County, which includes Deltona and New Smyrna Beach. Karen was born in Jamaica and immigrated to the US in her early 20s. And she has been a political strategist, campaign manager, and mediator ever since. Karen also serves as a vice president for the Florida Democratic Party. On the topic of healthcare, I found out she is a cancer survivor and is obviously very upset about the recent Roe versus Wade decision and is a strong advocate for women's health rights. She's also very concerned about the affordability of healthcare, like so many of us are. Karen, we're excited to have you on board on this forum, and the house is yours. The floor is yours.
Good evening, everyone. I just want to first say thank you all for getting together this body on this topic of medical and national emergency crisis. I am, as you said before, not only honored, but truly blessed to be entrusted in this role, to be one who would get to Congress to help secure this important bipartisan necessity to each and every American in this country. I support Medicare for all 100%. Let me just repeat that. You heard me. I'm getting some emergency calls as we actually have someone who is literally on life support this evening. And please bear with me. My sincere apology for getting those abrupt calls. I'm going to try and turn it off. One moment. It is for all these reasons why we want to make sure that healthcare is realistically a human right in this country. There's no way this country should have people going to bed worried about how they're going to pay their bills or just how you contribute having worked your entire life and then end up having these crises in life. And so, you know, we all know where this U.S. Representative Pamela Jingle, who brought this bill into the House, herself and Debbie Ringel introduced the Medicare for All Act in 2021. This transformative legislation that would guarantee healthcare for everyone in America is a human right, as I stated before. And at this moment, it needs to be. 100 million people are uninsured or underinsured during the pandemic. The Medicare for All Act builds upon and expands Medicare to provide comprehensive benefits to every person in the United States. This includes primary care, vision, dental, prescription drugs, mental health, substance abuse, long-term services, supporters, reproductive health care, and more. The Medicare for All Act of 2021 also includes universal coverage for long-term care and with no cost sharing for the elderly, for the disabled, and prioritizes home health and community-based care for for long-term care. Additionally, patients have the freedom to choose the doctors, hospitals, and other providers they wish to see without worrying about whether a provider is in the network. Importantly, the legislation streamlines the healthcare system to negotiate drug prices and to reduce the exorbitant costs of administrative waste. Endorsed by 300 local, state, national organizations, and co-sponsored by more than half of the host of representatives and caucuses, including 14 committee chairs and key leadership members, the landmark bill provides comprehensive benefits to all with no copays, private insurance companies, deductibles, no other out-of-cost sharing. The Medicare for All Act builds upon and expands Medicare to provide comprehensive benefits to every person in the United States. This includes primary care, as I mentioned before, and the subsidies that goes with this, including reproductive health care. The Medicare for All Act of 2021 also includes universal coverage, as I mentioned before, for long-term. We here in the state of Florida, for a very long time, Florida was seen as the retirement state. And until we had the invasion of people who see themselves as freedom blockers, this was long seen as a retirement tropical paradise and a state for institutional, for schools and education, and basically it's a choice of a tropical climate. But it is fair to say that the cost of healthcare exceeds the cost of living in most cases. I, as you heard before, have been a cancer survivor. But beyond that, I too have experienced disability due to trauma, of neurological trauma. And sometimes healthcare is sometimes invisible for so many people because the disabled that live among us in most cases are invisible and functional. There is no question in my mind that healthcare in a country that is seen as the most powerful in military provisions, allowances, and just strength, that we should allow anyone who is striving to provide for their families. Healthcare is, other than student loan, and in most cases more expensive, forces so many of us into poverty and struggles. The option of having to pay for, the choice of paying for medication versus food, or paying for your copay, even going to a hospital. There's no reason we should have this experience in a modern world. And it's for some of those reasons why I feel it is so imperative that people, almost everyone on this call, if you haven't experienced a health crisis, I guarantee it, you know someone in your close circle that has had to endure that. Having to be a caregiver and or just seeing the people around you having to make those choices. You all heard my story. I'm from Jamaica, and my country is seen as a third world country for the most part. But one of the things we've experienced in most countries, even here in the United States, is folks living around us who have real challenges. We still have a society that has hunger and poverty and homelessness. And if you really think about it, almost everyone has had some financial struggles, and it was all health. So I'm one of those people who believe that however we see this, I know that there are options. For example, the single payer, refers to healthcare system in some ways where the government pays. The term Medicare for all sometimes is misunderstood and propaganda to be socialism and socialistic behaviors or whatever. The bottom line is that healthcare is truly an essential part of our economic wellness. And a country that is striving for financial growth, sustenance, it is important and imperative that we maintain this. So however the board assents, single payer could refer to healthcare that a government other than the US government finances. For instance, some other countries have a single payer system that is not Medicare. As example, for example, what happens in UK, in Europe, and in Canada, a single pay system under different name, the National Health Services, etc. Medicare is a current federal health insurance program that funds hospitals and medical supplies in some cases. We know that for Medicare currently, it is provided for seniors and for the disabled in most cases. I believe that even in cases of prenatal care and post-traumatic cases, folks are literally going to hospitals. I know there's some medical practitioners here. The reality is, if we want to make America strong, if we want to make and give everyone an opportunity to have a good life, we should be able to provide Medicare for all. And so this evening, I hope to be a partner in advancing this, because as I said before, when you have the experience, you know how to relate, to mediate, and to share your common values. And I'm just telling you this evening, folks, that you will have a partner in me on this line. And I trust that we will get some of these things accomplished. It is, again, not just for health, but for economic strength and for the wellness of our families, to take care of the sick and the needy. And so I thank you this evening for the opportunity to address this body. I thank you for those of you who have voted for me to entrust me with your votes. And I humbly ask you, please vote Karen Green for Florida. Go to the website where you can see more about me, but let me be a partner in making sure that our fathers, our mothers, our sisters, our children, or the women in our community who need to be protected from every varying conditions. Please, thank you again for the opportunity. And I will say it, Medicare for All is a national necessity. It is an urgency. And I thank you for the opportunity this evening. God bless you.